Hello, everybody, and welcome to the Tuesday edition of Video Clips, which is brought to you by Wellness Forum Health, the Wellness Forum Institute, and Make Americans Free Again. So, this week, Friday and Saturday, is our Cancer Summit. You don't want to miss it. For people who have cancer, you can't afford to miss it. For everybody else, we all know people who suffer from cancer. And it's the most difficult condition, can be the most difficult condition to treat. We're going to feature a lot of guest speakers who will discuss things like special diets for people who have advanced cancer. The keto diet, source of a lot of controversy, but we're going to straighten that out for you. Supplements, the use of supplements, how to manage your oncologist and develop a survival team, the psychological aspect of cancer, which is so important. So anyway, you can go to our website at wellnessforumhealth.com and see the information there. It's on our calendar, but this is the time to sign up. And a couple of ways to help pay for it. One is you can use smoothie points. And if you don't know about that, send me an email. Another is we have a promotion right now for people who are not members of Wellness Forum to become a member. You get a certificate equal to the amount of membership dues that you pay, because we have varying levels of membership, and you can apply it to the Cancer Summit. Another option is upgrade your existing membership to annual pass, because annual pass members get to partake in these types of workshops for free every year. So if you want to talk about ways in which you can attend the Cancer Summit, then let me know. My email address is pampopper@msn.com. So I have two topics I want to talk about today. One is we're going to put some common sense back into medicine, and I want to talk about continuous glucose monitors, and then we'll get to thyroid supplements, not meds, but supplements. Okay, so first topic, continuous glucose monitors. And I'll just start by saying this. I mean, a long time ago, our medical system started down a very destructive path. My upcoming book, which will be ready for publication soon, traces the history of this and how we ended up where we are now and how to get out of it. Part of the downhill slide has been teaching people to pay more and more attention to more and more meaningless things and less attention to what matters. An example is the annual check-in with doctors. Visibly unhealthy, overweight people dutifully show up to seek expert analysis of their health condition. Apparently, looking in the mirror and a self-assessment of symptoms and that sort of thing doesn't work. You have to have an expert tell you that you're overweight and sick. To add to the insanity, drugs are prescribed, or more accurately, mis or overprescribed, instead of showing people how to recover their health, and that should always be part of the discussion. Another part of the downhill slide is the increasing use of devices to constantly monitor everything. Calorie intake, steps taken daily, heart rate, blood pressure, glucose levels are examples. And all of this is a distraction from what matters, and perhaps that's the point. In spite of constant doctor visits and monitoring and testing people, they're getting sicker instead of healthier. I mean, just look around. You can see it every place you go. I hate to tell you this, but substituting beef tallow for seed oils when making French fries in fast food restaurants isn't going to help. And wearing a continuous glucose monitor is not as productive as reviewing what's in your refrigerator and what's on your plate every time you sit down for a meal. We're just focusing on the wrong things, and we need to change that. According to a study published in the American Journal of Clinical Nutrition, continuous glucose monitors, or CGMs, overestimate glucose levels in healthy adults, constantly reporting elevated glucose levels 2 to 4 times more frequently than finger prick tests. I don't even know where to start with this, but first, why are healthy people monitoring glucose levels in the first place? While a type 1 diabetic, understandably, can benefit from using a skin prick test until he figures out how to eat properly and administer insulin, a non-diabetic should be paying more attention, again, to what's on the plate 3 to 6 times a day. According to this study, whole fruit was determined to be a no-no. Of course, apples and pears are the cause of obesity and diabetes, I suppose. And avoiding those while sitting and eating fries made with beef tallow is a better option. I mean, this is just ridiculous, this villainizing fruit, for crying out loud. Fruit, we have a sweet taste buds on our tongues, and they're there because we're supposed to eat fruit, not chocolate, by the way, as much as I love it, but that's specifically there. Those taste buds are because humans are fruit eaters. Overall, CGMs have overestimated people's time spent above healthy glucose levels by almost 400%. You heard that right, 400%. One of the reasons for this is that the devices measure glucose in the fluids surrounding the cells, not directly in the bloodstream. Over the years, we've reviewed the silly watches that record your heart rate and calorie burn. They're useless and wildly inaccurate. The calorie calculator's useless. I mean, I don't know how to figure out what I had for lunch today. It was a big salad with beets and chickpeas and cucumbers and tomatoes and two different kinds of lettuce and spinach. And how do you even figure that out? And who would have the time to weigh the chickpeas or count them out? This is just ridiculous thinking. The devices that measure steps mislead people into thinking that if they take 10,000 steps per day, they're getting enough movement. I mean, I probably do this at our office just based on the size of the building that we're in, but I don't confuse that with exercise that builds a strong body and aerobic fitness that keeps me lean and my heart healthy. When I talk about this, people defend this silly busy work with statements like, well, it's better than nothing. Well, my response is, why are you setting your sights so low? Why do you tell yourself that doing something useless is better than nothing instead of striving for health or waiting until you have cancer or some other dreadful disease that forces you to up your game? Let's put some common sense back into healthcare. A chapter in my book is The New Healthcare is Self-Care. Your daily choices matter. Stop fooling yourself into thinking that the garbage you called lunch is okay because it didn't spike your glucose on a fake measuring device, or that sauntering around your office building at lunchtime to meet your steps goal is exercise. Start striving for health, which is not to be achieved by falling for the silly gimmicks that generate clicks but don't really lead to health. And so there are articles in the library about the silly devices and all that sort of thing, but really common sense. I mean, people can look in their grocery cart and in their refrigerator and what's on their plate for dinner and tell if they're on the right track or not. And if you don't know, then learn how to read the medical literature. That's one of the things we pride ourselves in. Informed medical decision making means that the consumer is informed and proactive about making choices and not relying on health professionals to tell you what to do. You get to help with the decision making too. And in many cases, you may even find that you know more than your doctor or doctors about some things. I almost forgot to mention, we have a free event coming up this week. Free is always wonderful. It's called Empower Yourself. It's Wednesday, March 19th at 8 p.m. And we're going to talk about three big categories. One is some research tips. I'm going to give you 10 easy things you can do to find things out on your own. The second one is green tea and cancer, in keeping with our theme for the week, which is our cancer summit coming up. Different types of tea, how can you use it to your best advantage to prevent cancer or use it as part of your treatment? And then last but not least, why is it so hard to lose weight? I've mentioned this before, but the failure rate for obese males trying to reach normal weight is 99.92%, and for females, it's 99.85%. Obviously, something is wrong, and we know what that is. I'm going to share it with you. So you'll learn why programs fail and how weight loss can be achieved, and you'll be surprised about some of what you hear in all three categories, I promise. All right, other topic I told you that I wanted to spend some time on is thyroid supplements. So let's cover another insane factor in healthcare these days, the thought that most people who gain weight or are tired or sluggish suffer from hypothyroidism. I can assure you that this is not the case after helping tens of thousands of people with their health during the last 28 years. Once or twice a year, we encounter a person who actually has undiagnosed hypothyroidism and benefits from medication, but 99% of the time, diet and lifestyle habits are the cause of symptoms or medications the person is taking or something of that nature. Now, there are two things to be aware of when pursuing hypothyroidism as the cause of symptoms. And the first is that the changed diagnostic parameters have affected diagnoses, and there are lots more of them. This has happened with most conditions where, in order to prescribe more drugs, these changes are driven by the makers of drugs. More and more people get diagnosed. So you have to be careful about that. The other thing you have to be careful of is that people who are placed on medication who shouldn't be and take it for a long time, sometimes find out years later that they can't completely withdraw from the medication. In other words, taking the medication actually gradually disables the thyroid and makes you dependent upon it. So you want to make super sure that you're actually a candidate to take thyroid medication before you get placed on the drug. Now, second thing to keep in mind is some people take the so-called natural route and use supplements to support thyroid function. A doctor who saw this repeatedly with his own patients purchased the top 10 thyroid supplements on the market and tested them to see what they contained. He was quite surprised. 5 out of 10 contained thyroxine or T4, and 9 out of 10 contained T3, the more active form of hormone. What was even worse was the high dosage of the hormones in the products analyzed, higher than many doctors would write a prescription for had you been tested and a prescription issued. This becomes even more dangerous if a patient taking these products is also taking prescription thyroid medication. Add to this the fact that patients cycle in and out of taking supplements. They don't take them as consistently as they do drugs. And an individual has a real chance of cycling between hypo and hyperthyroid without knowing it, or even creating a crisis. Other ingredients in the supplements included copious amounts of iodine, which can induce hyperthyroidism and other health issues. Many people have the erroneous thought that supplements are natural. Actually, not so much. And as many of you have heard me say, the ones you have to be the most careful about and concerned about are the ones that work, because if there's an effect, there's going to be a side effect. So, some points to remember about hypothyroidism. It's overdiagnosed, no question. If medicated for a long time, sometimes withdrawal from the meds is difficult or impossible. So, make sure you are actually a candidate to take medication. Supplements often contain as much or more thyroid hormone as one would take in a prescription, and medicating away symptoms due to poor habits with drugs or supplements is never a good idea, and it usually backfires. How do you know if you're a candidate to consider hypothyroidism when you suffer from fatigue or not feeling well? Well, Occam's razor, the 14th century friar who said the simplest explanation is usually the best. First of all, eliminate all the risk factors you can: weight, hydration, food, sleep, exercise. And then, if symptoms persist, then you can start looking for causes and consider hypothyroidism as the cause. Then see a real doctor and get a real prescription for your condition. So, hypothyroidism is a real disease and it affects a lot of people. It just affects far fewer people than are medicated for it. So, be careful. It's often an overdiagnosed condition. And many times, what people really need is to change their ways, and your feeling terrible is just a wake up call to do that. All right, that's it for today. As usual, pass this on to anybody who you think would enjoy watching it. Don't forget Cancer Summit this week, Empower Yourself free workshop this week, this wonderful special where you can get points for buying a membership. Lots going on at Wellness Forum, lots that's interesting to learn about. So send me an email at pampopper@msn.com if you want more information. That's it for today. Thanks for watching, and I'll be back to you on Thursday with more news.